And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna. Today we've got a special presentation on dizziness and vertigo. We're going to give a broad brush overview about why it is that dizziness can be such a challenging condition, all of the moving pieces, and then what some of the different therapies that can be done that are going to help with this particular kinds of conditions. What we're also going to do is have a look at a few tangible exercises that you can start doing on your own that might be able to help. Now, before I start this particular video, I need to share a little bit of a personal story here. This is something that I have dealt with personally. So we can rewind the clock. The time of this recording, this is 2024. This would have started approximately 2011, 2012, where I had a lot of really good things going on in my life. I had recently gotten engaged. I just started my own practice. I was doing a lot of very competitive ultra-marathon running, and I'd actually just finished writing my very first book. And unfortunately, at the same point in time, I then started to experience daily headaches, which turns into migraines, that turned into dizziness that I experienced every single day for over 12 years. Now, drove me absolutely nuts because what I thought at the time is that I thought that it was simply a matter of just having an issue with my neck. If I could get that properly adjusted, it would all go away. Now, it does turn out that, my neck is certainly a significant piece of this. Lucky me, I was born with forceps, so there was some damage that happened from day dot. But that in and of itself wasn't enough. And unfortunately, where I was living at the time, I was having a lot of treatment that was helping me feel less bad, but nothing ever substantially made any change. That took a toll on my personal life. That took a toll on my marriage. That took a toll on my practice, ultimately to the point where I stepped away from the full lot of it. So I will testify firsthand, first and foremost, that dizziness is an absolutely dreadful sensation. Pain in the body, headache, sciatica, tingling into the hands, the fingers, things like that. To a certain degree, you can mentally block that out. But dizziness and vertigo, you can't. And it is exceptionally draining. It's challenging on the individual. It's challenging for everybody around you because you just don't know what you can do to help out. Now, I'd love to say that I have everything completely solved, even at the time of this recording. Nope, we're still learning things. But what I want to share with you are some of the broad generalities of what I've learned, what's helped me personally, and what I've seen has been able to help out so many other people who experience this particular kind of condition. So let's go ahead, let's jump into it right here. So firstly, a couple of little statistics. 20 to 30% of the human population is going to experience dizziness or vertigo at some point in their life. It's just a little bit of a brief distinction between the two. Vertigo is the sensation as if the whole world is spinning around you. You feel stationary, but you're hanging on for dear life because nothing in life is stable. There's going to be a sense of just needing to, collapse to the ground. Sometimes being on the ground feels worse. Getting sick, super duper common. Vertigo, real wretched. Dizziness, on the other hand, this is a sense of disequilibrium or fog in the brain where a person's world is stationary, but internally they feel like they're going like this, side to side, back to front, different kinds of things like that. Truth is you can experience a little bit of both of those. And we're going to talk about a few of the, more common vestibular conditions in just a wee little bit. But what I want to hit on first and foremost is about how your balance and equilibrium system works. It's all about your brain. Your brain is an amazing supercomputer. And for us as human beings who stand upright, we are the only mammals who spend, actually the only animals at all, who spend the vast majority of our time bipedal. What it means is that your brain requires a huge amount of bandwidth to be able to process equilibrium and balance information so that we know where we are in open space. And it's going to receive this input from three primary sources: vestibular, ocular, and then somatic. So what are these? Vestibular system first. This is referring to the organs of your inner ear, arguably the smallest organs that are in your body. And we can subdivide these into a few different subsections. So the first section is the vestibule. This is the part that is letting your brain know where you are relative to gravity. Are you moving this way or are you moving this way? Are you moving forward, backward, up, and down? So stationary kinds of movements. The semicircular canals, these are the parts that are going to be responsible for when there is motion, something going on like this. And a bit of a preview, this is the one if a person ever feels like their whole world is spinning around them, it's the semicircular canals that are going to be involved. And there's also going to be the cerebellum. Cerebellum is a major part of the brain, right at the base of your skull right here, that is essentially the major processing hub and the conductor for oh so many things, if not everything, that is going on inside of the rest of your brain. So vestibular organ, that's number one. Number two are going to be your eyes. Your eyes are always giving your brain information about where your body is relative to the environment around you. It's going to let you know if things are crooked like this, things are crooked like this. So combined with the inner ear, it's letting your brain know where your head is and then the rest of your body relative to space. The third part then, this is going to be the somatic system. So for example, you close your eyes and I say, put your finger on your nose. Well, you didn't use your eyes and you weren't using your head. You have nerve receptors throughout your entire body that's sending signals up to your brain about where everything is in open space. And even though there are signals from all parts of your body, there are three major players of the somatic system. Number one is the joints of the upper neck. They work like transducers, sending your brain information about where your head is, because where your head goes, your body goes. The second one is actually going to be your jaw. Jaw also sends a huge amount of signals up to your brain about where it is in open space, because if it wasn't, you wouldn't have the normal ability to bite down. Your jaw would be off even a tiny little bit. You'd be cracking your teeth with every single bite you took. That's not going to be very functional. So huge amount of input from your jaw. And the third one makes sense. This is going to be from your ankles, because the ankles are the part that are in direct contact with the ground. Now, what do I have with this horrible picture right to the side? This is a tract in your brainstem. It's known as the medial longitudinal fasciculus. No need to memorize the fancy name. My simple point in showing you this picture, and I've done it where you can only see the pathway on the one side, but truth is you have pathways on both sides, and you have information that is crisscrossed and always in constant communication among the cerebellum, among your vestibular organs, among your eyes, and also among input from your neck, your jaw, your ankles, and everywhere else in your body, going into these processing hubs in your brain in order to process all of this information, to keep everything in sync. Like I said, brain uses a huge amount of bandwidth to process balance and equilibrium information. And this is the crisscross of all of that information. Now, if everything is working wonderfully, no problem. You're going to feel just fine. But the problem is, what if the signals are mismatched? What if the information from your ankle doesn't match what's in your eyes? What if the information from your inner ear doesn't match what's in your neck? Then what you start to experience is this internal abnormality that we call disequilibrium. And this is going to be important then, because again, you can see you can actually experience a balance issue from any one of these. So the question is, what system is actually involved? Same breath, your brain's not stupid. It's not going to depend on just one bit of input. And it's going to find clever ways to adapt for each one. But as we go through life, if we have the accumulation of lots of stuff, that takes away from your brain's bandwidth power, that eventually is where we're going to start to experience issues. In my own case, I didn't start experiencing dizziness till I was 30 years old. But like I said, I had a birth injury so there was damage to the joints of my neck, there was damage to the joints in my jaw. That took 30 years to manifest. Again, 20 to 30% of people experience disequilibrium at some point in their life. But we also know that people don't experience symptoms until their brain power bandwidth has been whittled down about 50% from where it is supposed to be. That can happen all at once, or it can happen over a long period of time. And we can break that down then into 5 general categories that are going to be contributing toward this, or what I'm going to call the 5 I's, in no particular order. Number 1, inflammation. Inflammation, which is going to be grossly influenced by what is in our diet, what's in our physiology, what's in our blood, what we eat, what we drink, all that sort of stuff. Anytime that we have inflammation in the body, that is going to reduce your brain's bandwidth power, setting you up for aggravations of some kind. And if it so happens to be that equilibrium center or those centers, it's going to make us start to feel dizzy. Second one is going to be physical injury. It doesn't always involve broken bones, bleeding, or even bruising. If the damage is on the inside that affects any of these nerve receptors, that affects the ocular tracts, if it affects the brain itself, such as a concussion or a whiplash injury, or the accumulation of repetitive stress activities over a period of time, these injuries compound and they're going to lead to those kinds of issues. Number 3, this is an infarction. In other words, a bleed or choking off of blood, oxygen, and energy supply up to the brain. Usually it's going to happen all at once. If it affects the balance equilibrium centers, there's our dizziness right there. Infection, same thing. We ever get an infection onto the inside, if it affects either the eye, if it affects the nerves, if it affects the vestibular organs, this can be instant dizziness, vertigo. And then also interference. The reason that I say interference is like, well, what does that actually mean? This was that example I discussed earlier where you can have the mismatching of different kinds of issues because information from one sensory organ does not match what's going on with another system. Or, using the brain analogy again, as powerful as your brain is, think of your computer. If you turn on every single program all at once and you start streaming videos on YouTube and you start trying to upload family photos and everything all at once, the system's going to freeze. Its processing power is finite. So if we haven't been sleeping well, if we have a whole bunch of stress, and especially if we've had inflammation, previous injury, and other things going on, same thing. That's going to decrease our bandwidth, setting us up for these different kinds of issues. And what will happen then is it starts to produce a little bit of fuzziness. So at any given moment in time, your brain, because of how it's receiving all of these signals, it's got a clear map about where your brain, where your head, where your body is in open space. But when you've got the accumulation of all of these things, then suddenly that message starts to get a little bit fuzzy. And what we experience is a phenomenon that the neurologists call smudging. It's where your brain is no longer sure about where your head and your body is relative to the environment. That's what's going to make us start to go a little bit wonky. The reason that I mention this is because when it comes to healing from different kinds of vestibular issues, the key is removing the sources of interference, restoring the function as much as possible, and retraining your brain about where your sensory maps are. Getting it from what had been caused with whatever damage or whatever's going on, where you've got this smudging and blurring of the lines, back to as clear as humanly possible where your brain and your head is in open space. Now, we can spend a whole bunch of time on different kinds of named conditions when it comes to either dizziness or vertigo for that matter. But what I'm going to do is I'm going to divide them into 2 general categories. I'm not going to spend too terribly much in terms of what all of these different conditions are. Simply put, that when you understand the nature of a person's symptoms, it allows you to ask the more appropriate question, not just what's the name of the condition, but what is causing it in the first place. Because if we are dealing with a peripheral problem, this means that there is something wrong with either the body, the eyes, or the inner ear that we need to rehabilitate. If we're dealing with the central issue, then what we're talking about is something that involves inflammation, something that involves the brain, and we need to focus our efforts there. So having a look at just a few of the common ones. So number one, a somatosensory dizziness. This is the issue where a person's eyes, their inner ear may be working just fine, but you've got corrupted signals from either the upper neck, from the ankles, from the jaw, and it's creating this mismatch, making a person feel a little bit wonky. You can have what's called a binocular visual dysfunction. This is where the problem is coming from the eyes. You can have benign paroxysmal positional vertigo. This is the kind of vertigo that, and again, the whole world's spinning, where a person says, I feel worse when I lie down and when I move my head in a certain direction. And this requires then a very specific kind of maneuver in order to help resolve that inner ear issue. And then you can also have what's known as a vestibular neuritis. This is going to be an infection of the inner ear that can usually be resolved medically. Now, on the flip of that, we've got the central causes of disequilibrium. So this is going to be arguably the one that I experience, chronic subjective dizziness. This is where from the outside world, everything looks like it's just fine. But on the inside, the person is always feeling off like this. A wire is getting mismatched in the brain from one of the peripheral sensors, and then it learns that this is just the way that it is, and so there's this perpetual loop that's going on in the brain. You've got to identify the peripheral causes and also address what's going on the inside. What's known as a mal de debarquement syndrome, very, very similar. The only difference with this one is that a person says, yeah, I feel dizzy pretty much all the time, but when I'm in a moving vehicle, whether plane, train, automobile, I feel better. It's because your brain, it's suddenly receiving more vestibular inputs and it's able to disregard all of the other weird signals that it was previously experiencing. Meniere syndrome, this is a combination of both a physical issue, it seems to involve the neck to a certain degree, but also inflammation of the inner ear organ that has to be managed, both combination dietary, physically, but then also retraining the brain that if and when you ever do have a sudden attack of vertigo, but it's not coming from the crystals of the inner ear, that you need to basically get things back in and under control. And the last one is what's known as a functional neurological disorder. This is simply put where your brain is playing a trick on your mind. We have, as human beings, we have our logical aspects of ourself, we've got our emotional aspects of ourself, and we've got the core survival parts of ourself. This is where, at a subconscious level, either the survivor centers or the emotional centers are sending out danger signals to our physiology, messages that crisscrossed in the brain, and then we start to experience very real symptoms, but where they are emotionally driven. So this is where a person is going to be, when I experience more stress, I get more pain in my body, I start feeling more dizzy, or I start to feel anxiety. In fact, balance issues and anxiety go hand in hand. Remember that analogy that I used about overloading the circuitry of your brain? Well, it seems to a certain degree that if the vestibular processing centers are overloaded, so much of that excess information spills over into the crisis centers of the brain, and then we start to feel a sense of anxiety and agitation. And truth be it, the person who feels these kinds of symptoms, who doesn't feel anxious, that's actually the abnormal person. So the two things oftentimes are going to go hand in hand. Completely real, but I repeat, brain is playing a trick on your mind. So we got to figure out then, how do you get things back, no pun intended, back to equilibrium? Now here's the tricky part. As you've seen and as I've talked about so far, there are so many moving pieces with all of this that it's honestly not even funny. And this is one of the reasons why resolving vestibular issues can be so challenging, and why nobody, and I repeat, nobody has all of the solutions. Because what were the different players that we talked about? It can be the upper neck, it can be your lower neck, it could be your jaw, your ankles, your eyes, the inner ear, or it could be the brain itself. And each one of these is a different specialist, because the human body is so complex that human beings, we can't absorb all of that information. We have to have specialists because nobody can possibly understand that all. So if it's the upper neck, who do you need to see? It's an upper cervical chiropractor. If it's the lower neck, osteopath or a physical therapist. If it's the jaw, neuromuscular dentist. If it's your ankles, a myofascial therapist or some other kind of body worker. If it's your eyes, neuro-optometrist. If it's the inner ear, vestibular physical therapist. And if it's the brain itself, that functional neurological disorder, this is where you need to work with either a functional neurologist or any number of different holistic therapists that are working on brain stimulation. These include energy healers. These include people who work with colors. These include people who work with aromas. There's a time and a space for all of this stuff because it's helping the brain to better integrate information. And anything that helps your brain work better is going to be good for you when it comes to resolving vestibular issues. But what it also means, in truth, is it's really, really freaking hard. Nobody has all of the answers. And as much as I wish that I could say, oh yeah, here's the one and only thing that you need to do that has to solve 100% of it. Vast majority of people who experience balance issues, they need 20% of this, 20% of this, 30% of this, and 30% of this. In other words, it's a combination of different treatments to get the breakthrough that you're actually looking for. So very important then that when you're looking for answers, you have the right kind of testing done to find out what department or departments do you need to be in. You need a team of people helping you out here. Now, I'm not going to pretend that I've got all of the answers here for you, but what I do want to show you is some very, very basic vestibular testing that helps define and identify where is the issue coming from in the first place. So I've got a little video here for you, and we're going to break it down into a couple of bits here. But in brief, what you do is you're going to stand like I am right here with your feet together. And I do recommend, if you have a balance issue, do this with your hand right by a wall so that you can catch yourself if and when you might start to go and falling over. So you bring your feet together, kind of like this right here. Cross your arms, just gives a little bit of information. And then you start doing that out, just standing there still. Whoops. You do that standing still. If you could do it standing still, close your eyes and see, does that change? Then what you do is you repeat the test, but you're standing on a thick pillow. So now you've got less information from your body going up to your brain. You do it with eyes open and you do it with eyes closed. It's not 100%. And again, there's a lot of crisscrossing information. But nevertheless, general rule of thumb is when you're just simply standing on the solid ground, if you start swaying like that, we're talking about an issue that's wrong with the somatic system. If it happens when you're on the pillow, your brain has to depend more on your eyes and your inner ear in that situation. So when you have your eyes open, the eyes are actually providing the vast majority of the information. But then if you close your eyes when you're on the pillow and then you start going off, that means that you're most likely dealing with something with the inner ear. Now, I will also add with that if you start noticing a little bit of sway in any and all of these positions, especially when you're on the pillow with your eyes closed, a little bit of sway is normal. But it's if you feel that things are like going to drop you off to the side, or if you actually do go sideways, that means that there's a more defined problem in that particular area. So you can do this as a very basic screening to see, again, even if you don't have pain in your body, is there a problem that would warrant having a little bit of further investigation? Now, after that, and again, these exercises that I'm going to show you here, these are not absolutes. Everybody has got different kinds of vestibular issues. But remember what I had said about remapping the brain, allowing for these systems to start to actually talk in unison the right way. These are what are known as VOR, vestibular ocular reflex exercises. They retrain the brain so that your eyes, your inner ear, and your neck are able to work in proper synchronicity so that the signals are now communicating together the way that they were originally designed to. So what I'm going to show you here are 3 basic VOR exercises that you can test for yourself. I, again, most strongly recommend that you do this with a vestibular physical therapist, with an upper cervical chiropractor, somebody who knows if these exercises are going to be appropriate for you. But I'll show you this one way or another. Exercise number 1. Simply put, you hold your thumb out in front of you the exact way that I've shown you, like this. And then what you are going to do is you're going to be keeping your eyes fixated right on the thumb, and you're going to turn your head slowly side to side, keeping your eyes dead center, focusing on your thumbnail. Do this 10 to 20 repetitions per side. It's not uncommon if you do experience a bit of a balance issue that, whoa, you will feel a little bit of dizziness. This exercise is retraining your brain in the same way that you go to the gym. Oh, you feel a little bit sore afterward. That's a sign that you worked out the muscle the right way. The fact that you would feel a little bit of imbalance means that you're retraining your brain. Now, the balance should not persist feeling gross for about 20 to 30 minutes after doing this exercise, but it's a good litmus test to see where you are. And when it comes to retraining your brain, this kind of exercise, if you're going to be doing this, honestly, you need to do this multiple times a day. Bare minimum 3, 5 is better. So that's exercise number 1. Exercise number 2. You're now holding both of your thumbs out like this, about shoulder width apart, so that you cannot see both of your thumbs at the exact same time. And what you're going to do now, it might be a little bit difficult to see, but try it the best as you can. You're going to look with your eyes first. So looking to the thumb, and then you move your nose in that direction, and you're going back and forth. So eyes to one side, then nose. Eyes to the other side, then nose. So what you're doing is you're training your brain that your eyes and your neck and your inner ear can actually move independently of each other, that they don't have to be going exactly the same, and that it's different kinds of information that they are learning. So you go back and forth in this way. Again, 10 to 20 repetitions each side. The third exercise then, this is where you're coordinating more between your inner ear and your neck. So what you do, you hold your thumb out in front of you, but this time your nose and your thumb are going to move in the exact same direction at the exact same time. So here we are again, going side to side just like this. And as you can see, my nose and my thumb, they're moving in the exact same place at the exact same time, repeating 10 to 20 every single side. Now, as I said, that exercise may not be appropriate for every single person, because some people, their balance issue, it's going to be predominantly in the side-to-side orientation. Other people, it's going to be up and down. And other people, it's going to be crisscross or diagonal. So you test to find out, well, which center do you actually need to exercise? And then that's the one that you want to work on. Again, if you're working with qualified specialist here, they're able to help you find out exactly where that is. But as you're retraining your brain, and again, this is now where we're talking moving from a level 1 to a level 2 to a level 3 to a level 4 kind of exercise, this is where you can up the ante. So truth be it, some of these exercises here, if a person's dealing with a significant balance issue, it may take you months or even years to get to this point. The easiest way to start them out is just simply put sitting. If you want to up the ante, then do the exact same exercises standing. If that's easy, then you can do it standing on a pillow, because then that's, again, going to be a little bit more challenging for your brain. One of the hardest ones to do it is when you are walking. So I'm going to demonstrate so that you can see that, yeah, this is the kind of exercise I personally need to do, because of that shared experience. I'm going to be doing diagonal movements and I'm going to be walking. And what I want you to see is that, yes, this is a challenge for me. So I can catch myself, but you can see that that is a challenge. And you might find that happens when you're sitting. You might find if that's just standing, that's normal. You train to the level where you currently are. You don't want to do a level 4 exercise if you can't even do a level 1. So again, have a chat with a qualified specialist, but hopefully these general kind of exercises and the sequence that you would build up can help to retrain your brain, retrain those different balance centers so that you can start to improve your overall daily function. So again, I wish that I could say that I had all of the answers when it came to balance equilibrium conditions, but I repeat, the truth is there's a lot of moving pieces. My own circumstance. Stress definitely aggravates things, but lucky me, I seem to have a combination of my jaw, I have an astigmatism in my right eye, I have an upper neck issue, again, that's where I was born with forceps. I also have an injury to my low back from doing all that running all those years ago, and I also have an issue with my ankle. So you add the combination of all of those, it's been an extreme challenge trying to understand, not just understand what's going on, but ultimately find answers. There's not just been the one own thing in my own personal experience. It's been a combination, and I sincerely hope and believe that 10 years from now, I'll know a lot more about what's going on, because there are still days, there are still moments where, yep, I'm got a flare up, things are feeling particularly worse, and I've got to get the right treatments to get things back in and under control. But it's all about retraining the brain, retraining the body, and doing the very best that you can. So definitely a challenge, and my heart honestly goes out to any person who has ever experienced it, because again, I get it and I understand what it does very much to your life. Nevertheless, if you've got any questions, any insights, please do share them on the channel right here. Again, I may not have all of the answers, but I can at least direct or hopefully get additional insights that are going to help people get the best kind of breakthrough with these particular kinds of conditions. So thank you guys very much for watching this video. I do hope that you found it educational, informative, valuable, also maybe a little bit entertaining. If you did, please do click that like and subscribe button, and we'll see you next time. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well. Till next time, take care. Bye-bye.